Welcome to EAU podcast on endoscopic balloon dilatation and incision for treating primary obstructive megaureter in children. In this episode, we are joined by Dr. Martin Skott, Fellow of the European Academy of Pediatric Urology, Associate from Pediatric Guideline Group from Aarhus, Denmark. Dr. Martin Skott will present the findings of a recent published system review. Join us as we embark on this informative journey. Dr. Skott, welcome. And please tell us about the background for this systematic review.
Historically, ureteral re-implantation has been the gold standard for the treatment of primary obstructive megaureter. Indications for surgery being declining renal function, worsening obstruction, or recurrent urinary tract infections. In infants, open surgery with re-implantation of a grossly dilated ureter into a small bladder can be technically challenging with significant morbidity. Therefore, less invasive endoscopic management, such as dilatation or incision of the uretrovesical junction, has emerged as an alternative to re-implantation during the last decades.
And what was the objective of this systematic review?
To systematically evaluate the efficiency, safety, and potential benefits of endoscopic treatment of primary obstructive megaureter in comparison to ureteral re-implantation.
Which studies were eligible for including in this systematic review?
A total of 504 abstracts and titles were screened and 22 were retrieved for full text screening. Finally, 8 studies were found eligible, recruiting a total of 338 patients. There were none randomized controlled trials, there was 1 non-randomized study, and there were 7 case series. 309 patients were analyzed with a total of 330 renal units. Age at time of initial management was at a minimum of 15 days and a maximum of 192 months. Primary outcomes for benefits was stabilization of differentiation renal function on MEG-free scan or DMSA scan without further surgical management. The primary outcome for harms was an unsatisfactory result following the initial management, such as progressive loss of renal function, pain, or increasing hydronephrosis, but subsequently necessitated additional surgical management. The primary time point was 1 year of follow-up.
Can you please share us the main findings in this systematic review?
Between 35 and 79% were successfully treated with a single dilatation or incision of the uretrovesical junction. We observed a trend towards maintaining stable differentiation renal function on MEG-free or DMSA, irrespective of the management approach chosen. Across all studies included on our analysis, endoscopic treatment consistently resulted in a reduction in the diameter of the renal pelvis and ureter in the affected renal units. Overall, 40% of the renal units included in this systemic review ended up with salvage ureteral re-implantation due to relapse of symptoms. Most common post-operative complications were UTI, stent migration, stent intolerance, transient hematuria, or pain. De novo VUR was overall found in 8% and managed by either subureteral endoscopic bulking therapy or ureteral re-implantation.
Can you draw on any implications for clinical practice?
Endoscopic treatment for persistent or progressive primary obstructive megaureter in children is a minimal invasive alternative to ureteral re-implantation with a long-term modest success rate. Additionally, it can be performed within a wide age span with equal success rate and complication rates compared to ureteral re-implantation.
And finally, do you have any suggestions for further research?
Long-term follow-up studies of children diagnosed with primary obstructive megaureter and treated with endoscopic dilatation or incision are urgently needed. Additionally, randomized controlled trials comparing endoscopic treatment with ureteral re-implantation are essential. These studies should include pre- and post-operative measurements of renal function to accurately assess the outcome of each treatment approach.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.